Hello, everyone, and welcome to Conduent Healthy Communities Institute's webinar on exploring the root causes of health inequities, Milwaukee's collaborative CHNA experience. My name is Jane Chai, and I'm a community health content expert here at HCI, and I'll be your moderator for today. So we're so glad we're seeing folks joining us. We're seeing more and more folks come into our attendee room, so it's really nice to have you. I'll go ahead and start us off by covering a few logistics before we get started. So first, you've all joined this event as an attendee, so you're automatically muted for the duration of the webinar. If you have any questions during the presentation, please feel free to send them to all panelists via the chat box at the bottom right-hand corner of the WebEx screen. We'll be reviewing your questions as they come in, and we'll try to answer as many questions as we can throughout the presentation, or try to bring them up during our Q&A time at the end of the presentation. And lastly, a recording of today's presentation will be made available to you after the webinar. So let's get started with today's objectives. So during today's webinar, we'll be speaking with representatives from the Milwaukee Healthcare Partnership to learn about building a collaborative CHNA process that authentically engages communities most impacted by health disparities, builds upon community assets and resources to advance health equity, and incorporates findings related to racism and discrimination in the CHNA, or Community Health Needs Assessment and Strategy Development. And now I have the privilege of introducing our presenters for today. First off is Bridget Clementi, who is the Vice President of Community Health at Children's Wisconsin, which is a member of the Milwaukee Healthcare Partnership. Ms. Clementi has over 20 years of experience in improving child health outcomes and has successfully led community and school-based programs, partnered for policy changes, and launched population health initiatives. Bridget is a champion for inclusion, diversity, and equity efforts and acknowledges that the work she and her team engages in relies on her building meaningful community partnerships with community-based organizations and residents. Ms. Clementi serves on local and statewide advisory boards and committees and is an active member of Children's Hospital Association's Community Health Affinity Group. Next, we have Justin Rivas, who leads community health initiatives for the Milwaukee Healthcare Partnership, which aims to improve health outcomes and advance health equity through community-wide collaboration. Mr. Rivas previously served as network strategist and community coach for county health rankings and roadmaps, providing strategic guidance and trainings in support of data-driven and evidence-based community action planning for health improvement, as well as developing national partnerships aimed at addressing health issues for Latinos. He is the current president of the Wisconsin Public Health Association. And last but not least, we have our own Maudra Brown. Maudra is a public health consultant with Conduent Healthy Communities Institute with almost 2 decades of experience in domestic and international public health work. Prior to joining Conduent, Maudra served as Quality and Health Outcomes Director with South Carolina Health and Human Services, where she led the state's quality agenda and oversaw the analysis and tracking of quality metrics. In her current role, Maudra helps health departments, health systems, and community collaboratives conduct community health needs assessments and develop implementation strategies with an equity lens. For those of you who aren't familiar with who we are, Conduent Healthy Communities, or HCI, has been a leader in the community health field for over 15 years. We've conducted hundreds of community health assessments and implementation strategies with partners across the country. We're also known for our nationally recognized platforms that provide continuously updated health and social determinants of health data and acts as a hub for community health activities. The HCI team brings both a combination of advanced public health degrees and real-life experience in community health improvement. And now that we've introduced ourselves, we'll be turning off our cameras to maximize the audio quality of the webinar. We'll rejoin you back on camera during the Q&A portion of the webinar. And with that, I'm going to turn this over to Bridget to talk about the Milwaukee Healthcare Partnership.
Wonderful. Thank you very much, Jane. Really appreciate the opportunity to be here and for Justin and I to share with you some work that's been happening in Milwaukee. We wanted to start by grounding us in a little bit of background in case you are not familiar with Milwaukee County. we wanted to be able to provide you a little snapshot on Milwaukee County. The county is located in the southeastern portion of Wisconsin, right on beautiful Lake Michigan, as you see there in the screen. The total population for the county in 2021 was estimated to be about 943,000, and it's roughly 57% white, 27% Black, 7% who identify as some other race, and 5% Asian. In terms of the ethnicity, the Hispanic Latino population makes up about 17% of the population. I apologize for my video not being on there for a moment. The partnership is a partnership that's a 16-year-old public-private partnership. The backbone is really the 4 main health systems in the area. It also includes federally qualified health centers, city and local public health partners, and the partnership stands up the community health data site that Compass Milwaukee through Conduent. And so we'll tell you about all of that as we go through this process today. As you see on the next slide here, our mission of the partnership is to improve healthcare for low-income, underserved populations in Milwaukee County, with the true aim of contributing to health outcomes, health equity, and lowering the cost of care. The focus on health access is certainly prevalent, but we take a very broad kind of conceptual understanding that upstream causes decrease access. And so we aim, as you see on the screen, to really address the availability, the accessibility, the acceptability, as well as linkages of social determinants of health services, which all play into today's conversation. On this slide here, you see a little bit about our organizational structure. Now, we recognize that it's small and you're probably not able to read the details of this slide, but I do want to draw your attention to some of the key components of the structure, which will help you understand some of the background of the partnership and understand how we actually get the work like we're talking about today done. The org chart represents this comprehensive understanding about how we are organized. The main stakeholders, some of which I mentioned earlier, are there in that kind of maroon or red color on top. We affiliate closely with the state health associations and are led by a leadership council, which typically acts as our board. And we accomplish our work through standing meetings and standing councils and committees and work teams and supportive initiatives that you see there on the bottom. And that's really the area in which we lean into for our CHNA work. And it's the work of those work teams, in particular, the one of the Community Health Needs Assessment, of whose work we're highlighting today. Milwaukee County has been sharing a product of the 4 health systems coming together in a collaborative way around the Community Health Needs Assessment since 2012. This shared CHNA process really serves as a foundation for each of our hospitals and our local health departments, whereas they then go forward and develop their respective community health improvement strategies. The findings are also intended to inform a much broader audience about the top health issues facing our community. And here's a various list or mention of the stakeholders in which they are involved in this process. And they leverage this information, as I mentioned, to create their own individual CHNA reporting requirements that are required. These groups coming together through this process really allow for a shared prioritization process, shared community involvement and engagement, and ultimately a demonstrated unity around critical topics such as health equity. The assessment is grounded in a broad and comprehensive understanding of population health. We take into consideration that healthcare accounts, as many of us know that are joining today, for only 20% or up to 20% of what really contributes for overall health. In reviewing and analyzing the health outcomes and the health factor data around key determinants, a racial and health equity lens was utilized and revealed and called specific attention to health disparities and inequities. Health equity and health disparities, as we know and have come to understand even more and more each day, they're complex and they're closely connected, as are their root causes. Our new approach this past year addressed racism and discrimination head on to understand its historical and current connection to health, especially for those who represent communities of color. We think of our Health Compass Milwaukee site as really a data resource and kind of as our living CHNA. It continues to be a robust, rich resource for members across our entire community. In fact, just a couple weeks ago, I was meeting with our health commissioner for City of Milwaukee, and he himself was acknowledging how much he values and uses Health Compass. Specifically on our site, we provide current and comprehensive data sources, comparative analytics, health improvement planning tools for healthcare providers, and as I mentioned, public health departments who are finding more and more use out of it. It serves as a benefit for our broader community, including the multitude of different sectors that tap into it for additional information. And it elevates the importance of ongoing community health status and information to be available to support research and planning, grant requests, and community health or community-wide health improvement opportunities. It truly is an asset for Milwaukee Health Department, community-based organizations, health systems, federally qualified health centers, and much more. It was important to all of us that as we launched Health Compass, that we take a specific time to share a real focus on equity. And it was also important to acknowledge that we know that definitions really do matter. And in order to build capacity, continued understanding, and deepen that understanding, it was important that we really take time to define health disparities as preventable differences in health outcomes, such as infant mortality, as well as the determinants of health. Health equity, as many of us have come to appreciate and understand, is the principle that opportunities for good health in vulnerable populations are in fact achievable by eliminating systemic, avoidable, unfair, and unjust barriers. Progress towards achieving health equity can absolutely be measured by reducing gaps in health disparities. I believe now I will turn it over to Madra to share a little bit more about the 2021 CHNA process.
Thank you so much, Bridget. And thanks to everyone for attending our wonderful presentation. Looking forward to talking a little bit about the CHNA process. So the intention for the 2021 CHNA was to center on equity. And I know that's something that we will talk about throughout the presentation, but it really began at the very beginning. The partnership wanted to hear the authentic voices of the community they serve and develop strategies with them in mind. The partnership played a significant role in advancing equity, and we use the CHNA process and the approach as the vehicle to work toward achieving that goal. The prior CHNA work informed our approach for this cycle. We realized early that the existing partners were very essential for the work, and we did not need to create anything new. I like to always say we began with the end in mind and focus on developing strategies that would help us advance that equity goal. The process itself is crucial to understanding the health needs and the priorities of the community because they're integrated in the process step by step. It's really Milwaukee used the CHNA process really to ensure that the voices of all communities were heard. The process itself involves gathering data, engaging with the community members, analyzing those findings, and developing strategies for improvement. Milwaukee really tailored a comprehensive process and really gained authentic insight throughout. This graphic really just displays the cycle itself. It really is a systemic approach to assessing the community health and development and to develop strategies for improvement. Milwaukee and the partnership utilize the assessment and planning cycles to guide their efforts in addressing health disparities and promoting equity. The cycle really typically involves these 5 key steps, beginning with planning and engaging, collecting and analyzing the data, synthesizing and prioritizing, because everything can't be important at the same time. You have to really look at the data holistically and prioritize those needs for the communities that you serve, mobilizing that information to action, and never forget to implement and track. We really use the tailored approach to meet Milwaukee's intentions, and we're very mindful of them as clients and their equity lens. The partnership uses HCI services to collect that data and that approach we use to help us develop a better understanding of the community that they are serving. Based on the assessment, they develop a comprehensive plan that focused on addressing the identified disparities and promoting health equity. The implementation and evaluation phases ensured that the strategies were effectively implemented and measured for their impact on the health outcomes of the community. We engage so many communities in the CHNA work. We really ask a series of thoughtful questions to get their perspective on equity, social justice, racism, and inclusion. We really created a safe space where community members could talk honestly about difficult topics, which I think was essential to getting that authentic feedback and those really engaged and diverse data sets. Speaking of data across the health equity spectrum, it really plays a crucial role in understanding the health equity spectrum and identifying those disparities. Milwaukee used data to analyze those health outcomes, to access to healthcare, social determinants of health, and other factors that affect the health and the well-being of those that we serve. The data from the platform helped to identify disparities across different populations and communities within the city of Milwaukee. And analyzing those data across the health equity spectrum, Milwaukee and the partnership gained the insight into the root causes of disparities and could develop a more targeted strategy. The data platform, as mentioned before by Bridget, Health Compass Milwaukee, also helps and continues to foster that progress in monitoring, measuring the impact of interventions, and ensuring accountability as we continue to advance health equity. And just a little note around equity and communities experiencing disparities. We know that they exist, they're unfair and avoidable. In some instances, the health outcomes really exists between different populations, and it's so important to get that that qualitative and quantitative information so that you have an informed decision as you move toward improvement. These disparities and inequities are rooted in systemic factors such as social determinants, social economic status, racism, and discrimination. Disparities can be observed in various health outcomes. Access to healthcare is one that we talk a lot about, social determinants as well. The communities in Milwaukee have been experiencing disparities that result in a disproportionate impact on certain populations. And this partnership identified those trends and moreover, tried to really use the community to help them understand how certain populations are disproportionately affected compared to others. I'm going to hand it off right now to Justin to discuss in greater detail the partnership's goals in the CHNA work. Justin?
Thank you, Maudra, and good afternoon, everyone. Excited to present alongside Maudra and Bridget today. So I'm going to speak to our community health needs assessment in a little more detail. Here you see a screenshot of the cover of our report. That's all available on Health Compass Milwaukee. If you want to dig in a little deeper, we also had some other products alongside it, which look at data and some of the top issues. When we conducted our CHNA, we really kind of had three goals in mind. We wanted to really elevate the top health issues as every needs assessment would, but both through the quantitative and qualitative data and synthesizing that data, which Maudra and team helped support. We also wanted to use data to really describe health inequities in a meaningful way. I think folks that are familiar with Milwaukee or Milwaukee County anecdotally know of the story of the haves and have-nots of our community, but in being able to display this through data, through a needs assessment was really important. And we did this through data disaggregation and by creating priority populations in which we could meaningfully look at, for example, survey results and secondary data through disaggregated means. And then we also framed upstream key determinants of health. This was important to us because going back to that bar high spectrum that Maudra shared, we understand obviously that there are health inequities today, but they stem from root causes. And we wanted to be able to talk about two main ones, racism and discrimination, and also housing, knowing that they're interconnected as well. So on this slide, you'll see what our main three sources were for our CHNA in terms of data. Maudra would often call this the three-legged stool, if you will. We have primary data that relied on the survey that we conducted. This year, we explored a new way to capture rich data through the survey. Concerning the survey, there was a change in methodology. In the prior years, we'd used phone surveys, and that was challenging both due to decreased response to phone surveys during the pandemic, and also just to really reach the proportionate demographics of our population we wanted to connect with. So we switched to an online community health survey, which achieved a much higher overall response rate. However, it was a convenient sample. So I think we had over 9,000 total responses, and once the data was clean, got to about 8,600. We gained insight from numerous community organizations and stakeholders throughout our key informant interviews and focus group process. We spoke with over 90 organizations across the community and got to have really pointed conversations with key subgroups such as youth serving organizations. We reviewed and analyzed multiple secondary data indicators from Health Compass Milwaukee. I think we have over 300 up there. And then we understood that there was really a COVID caveat in this time frame of looking at secondary data. So we did our best to contextualize that through our report. Next slide. So here you'll see really high level the results of the report. These are the top 5 health issues from the CHNA, and these issues ranked highest when all 3 data inputs were analyzed and synthesized together. Ringing loud and true, mental health came up as number 1 across all sources and subgroups when we looked at that data disaggregation. Violence and community safety are severe issues that are concentrated in certain parts of our community. Drug use and overdose were top issues related to each other and continuing to spike, especially with opioid and fentanyl use and also overdose deaths. Importantly, we made a distinction between alcohol and drug use, sometimes categorized as substance use together, but knowing that they're both highly prevalent issues in Milwaukee County and also require different interventions. Alcohol continues to be a complex cultural issue in Wisconsin and Milwaukee, with really deleterious effects of binge drinking, drunk driving, and underage drinking that face our community. Access to care was a top issue that was elevated in numerous ways in terms of affordability, really importantly in our community, and also complications of accessing healthcare during the pandemic. You may note that there's a high level of intersection between these top 5 health issues, and really particularly we pointed out that there's intersectional effects on the highest need populations and communities of color in Milwaukee County across the 5 top health issues. There's certainly a lot of other issues that plague our community. You'll see the 3 issues of concern we elevated as well: maternal, fetal, and infant health, infectious disease, again, COVID concerns high, and then chronic disease continues to be a chronic problem. Each of these issues contain disparities and an equity lens in which to look at them that you could dive deeper into by viewing our report. So I'm going to speak a little bit to the priority populations that we identified for our CHNA process. We applied an equity lens to the assessment by prioritizing key populations in our analysis. And this was backed by the data. So we saw this in the data that these priority populations face unique health disparities, and prioritizing their health and calling attention to it, we knew would be essential for improving the health of Milwaukee County and through our CHNA report. We're specifically focusing on disaggregated data in these 4 buckets of Black African American population, Hispanic Latino, children and youth, so those under 18, and older adults and elderly, with just an example indicator for those disparities below each of those. So shifting to the key findings around the significant determinants, again with an equity lens, we really wanted to call attention to racism and discrimination and housing, but take a broad understanding of concepts on how they impact health outcomes. National trends have shown that systemic racism, poverty, and gender discrimination have led to poorer health outcomes in communities of color and in low-income populations. We found similar findings in our own CHNA and have called out these 2 main issues. We leaned on APHA's definition of racism, that racism affects opportunity and assigns value based on how a person looks. It unfairly advantages some individuals and communities and unfairly disadvantages others, and that racism hurts the health of our nation by preventing some people with attaining their highest level of health. So we were careful in, again, going to definitions and how we talk about issues like this, knowing that, these were contentious times when we were lifting this up, right, on the eve of racial equity movement in our country. We also leaned on the issue of housing, knowing that housing is connected to health in numerous ways, and we offered a really comprehensive view of the dynamic relationship. We understood housing that could be perceived through kind of 3 lenses of place, space, and economics. Where the housing is placed is important in Milwaukee County. We have what's categorized as a hyper-segregated community, and we know that it's linked to segregation, environmental conditions, pollutants, air quality, community safety, and access to transportation. We also know the space of a home or the quality of a house really affects health in a lot of ways. Knowing that lead exposure is a very large issue in our community, lack of adequate facilities and utilities, and overcrowding is a housing issue. We know that there's further a correlated toll on stress and mental health for individuals who are homeless or precariously housed or living just in poor quality housing. And then lastly, and maybe a little more nuanced, we know that housing affordability and home ownership are key economic factors that connect housing to health. We know that high or severe housing cost burden, which are the technical terms for when households spend 30 or 50% of their income on housing costs. We know that that is directly correlated to to food insecurity, to children living in poverty, to more people reporting fair or poor health. We know these economic challenges and their health effects perpetuate over time, especially when there's barriers to home ownership. And I'll get into that a little bit on the next slide, but we wanted to understand that there's really historical causes to this barrier between wealth and health over time in Milwaukee County. Next slide. So how we made sense of this in the CHNA is we utilized Conduent HCI's Health Equity Index, which is a modeled measure that's made up of 6 determinants of health. Here you'll see income, poverty, unemployment, occupation, education, and language. And it's you can analyze it by zip code. And this is helpful for us to look at that index value and kind of, for lack of a better term, heat map it across Milwaukee County. And you'll see on the next slide that we came to the conclusion that zip code may be the most important factor in determining lifelong health. So here's a map of Milwaukee County, which you may or may not be familiar with. The darker colors here identifying the higher value of that health equity index, higher being poor outcomes in the center city and near northwest side. And there's been a lot of assessments and analysis and reporting to characterize this issue in Milwaukee, but we put it to action. So what we did is we took the top zip codes, or the lower zip codes, if you will, here, created a subgroup in which to disaggregate our survey findings and our other data to better understand how these areas were most impacted. Next slide. And importantly, in a CHNA process, this is kind of a bit distal, right? But we wanted to call attention to historical causes to really understand why these health inequities exist today. And we did that by leaning on the issue of redlining. Milwaukee has a history of disinvestment and marginalization of communities of color, really through discriminatory policies and practices, so aligning with our theme of racism and discrimination. And this map on the left is a historic redlining map, for those of you familiar with the concept, just creating gradations of risky lending, if you will, with air quotes in the dark red areas. And these were primarily where communities of color existed, African-American neighborhoods. And what we're showing here is that a map 90 years later on the right of ALICE households, or asset limited, income constrained, but employed households, pretty much show a similar heat map. And what that's helping us understand is that this historical cause in the 30s translates to still where that health equity index aligns today. Next slide. So an important part of the CHNA is really gathering voices of the community and understanding, what these key informants really explain and talk about their own community conditions in their own words. And this quote, which I'll read, really just aligns with what I spoke to in the last couple slides. Putting it in a historical context, those aren't accidental neighborhoods. They were designed through redlining and reducing people's access to better jobs, housing, and schools. The historical context of racism still lives with us this day and builds barriers to building trust and providing resources to help them overcome these challenges. This is an important quote too, because I understand from large institutions or a health system, it's also elevating the issue of trust, which is something we dug into in our survey. Next slide. So I'm just going to move to some of the survey findings here, and just to orient you to this table, because there's a few of them. You'll see a column on the left with kind of what was asked about on the survey, and then you'll see survey results in those other columns, starting with just the overall survey response for the county, and then moving into those subgroups of priority populations that we spoke about: Black, African American, Hispanic, Latino, high need zip codes, households with children, and older adult and elderly. And here you'll see that, not just elevating the top health issues, we wanted to ask about the needs, and we had 23 response options, and the top 3 highest percentages that are called out in the red or maroon here, you'll see really aligned with access to affordable healthcare, access to mental health services, and access to affordable housing. Again, that was kind of true across all population groups. Next slide. So where we shifted with this survey is we wanted to ask quite pointedly about health equity. And we looked for tools or best ways in which this had been done. We uncovered I think the Kaiser Foundation, the Undefeated Survey, which was a racial equity and health survey nationally that occurred maybe 2020, 2021, was kind of a backbone for some of the questions we built into our own CHNA here. And we wanted to ask about experiences with racism and health equity at the individual level, but also at the community level. So these questions here, we're really asking at the individual level about unconscious bias with a brief definition, experiencing individual acts of racism and discrimination, and then structural or systemic racism, and then the interaction with healthcare, right? Feeling like folks were treated differently because of race or ethnicity. And here you'll see that in the subgroups of Black, African American, Hispanic, Latino, and high need zip codes, much higher percentage response rates, which would maybe align with some of the themes from the secondary data. Next slide. So just broadly, here's kind of a screenshot of a lot of different questions we asked about in this health equity portion of our community health survey. And it was posited with the understanding that health disparities do exist. That's a fact. It's in the data. And then folks got to answer whether they thought it was a major reason, minor reason, or not a reason, with some of these other issue areas that might connect to the health disparities. And some of them were, I'd say, more proximate or closely connected, and some might be more of a leap to someone who's not familiar with this issue area. Next slide. And just one example of results and what that looked like is when we made the assertion that historic gaps in wealth between white people and people of color were a reason for health disparities by race. We saw that, maybe surprisingly, across the entire county, 64%, so nearly 2/3 of the county would agree with that assertion. Probably to no surprise, communities of color that may have faced this, much higher agreement in terms of it being a major reason. But also this helped us understand kind of directly from the community, kind of the political will or the understanding of health inequities and its translation to social and economic conditions and also historical factors to hopefully potentially move changes in terms of local policy or programs. So I believe at this point, after going through the CHNA in detail a bit, I'm going to hand it back over to Bridget to just talk through a little bit of the healthcare partnerships response and sustaining action.
Thank you, Justin, and thanks for that overview of the findings that are really so prevalent across our community. As we know, those of us who are joining today and those of us that are active in the partnership, the CHNA, in gathering that data is just the start of the work that really needs to happen. And so ultimately, the naming of health issues and health needs with this keen focus on racial and health equity allow us to lead toward collective action and make action and change to improve health outcomes and close these disparities that you beautifully reviewed. We do this through a variety of efforts, really leaning in towards collective and collaborative work. And as you see on your screen, there are a multitude of different pieces of that puzzle, or of the honeycomb, if you will, on how we engage and align priorities, strategic priorities, tactics, et cetera, and how we really work across sectors and across organizations. So as you see here, we align with the Wisconsin's Department of Health Services State Health Plan that is inclusive and representative of work around Milwaukee County with the DHHS strategic plan. Our public health departments, as we noted, were active and are active members of the partnership. And as many of us understand, they are also responsible to produce community health improvement plans. So we want to make certain that there's alignment and coordination and collaboration with each of those as well. And then the health systems and their implementation strategies and plans are critically important for alignment of resources and shared prioritization processes. And finally, it is important to all of us that as we identify what advances as shared priorities and what efforts are we going to continue to lean into and to positively impact to advance health outcomes, we absolutely need the community initiatives and community to be involved and engaged in this process. So our annual plan really is reflective of alignment and opportunity of each of these pieces. And then we put together what is our plan for our annual priorities, which you'll see on the next slide. And this kind of pathway or product allows us to really be clear from the partnership lens on what it is that we are prioritizing. And the document, again, is a little bit small to read, but you see that we have 4 main areas or main columns in which we do our work. And we also identify if we are going to monitor, participate, or sponsor items and priorities in each of those areas. You can see in the red, we have circled some of the CHNA top issue areas and how they fit into our strategic and plan and collective work. And while this plan that we put together each year for the partnership is not solely focused on the named priorities of the CHNA, you can see that these issues are spread out and infused across the tenets of the partnership's annual plan, ensuring that we really do have the opportunity to holistically advance the health and healthcare of our community. So Justin, I'll turn it back to you just for a moment.
Sure thing. Thank you, Bridget. So I just wanted to kind of continue with how this journey, as you know, CHNA is on a cycle, right? So we wanted to explain how we're kind of advancing our commitment to equity as we are today had a meeting planning the next cycle. So we really wanted to review our CQI process from the last time, knowing we can build on it and make changes. And we faced a lot of, logistical challenges during the pandemic. We also wanted to pursue increased alignment and engagement with public health. We're doing this and have done this in that the CHNA that we are talking about today is the backbone and the data warehouse, if you will, for not only all of the 4 health systems and their hospital site CHNAs, but also we provide all this data broken down in a meaningful way for the City of Milwaukee Health Department to use in their CHA-CHIP process, as well as Milwaukee's unique. We have a City of Milwaukee Health Department and 10 municipals, so all the municipal health departments are able to utilize data as well. We also keep this ongoing in terms of the conversation with a monthly newsletter through Health Compass, our HCI website, and also through a data advisory group that really helps integrate community health data and make this a more enriched product and process as we move forward. And then it's constantly a question of alignment to Bridget's last slide about figuring out the strategies and plans and how to collectively move the needle to have impact in these issue areas, understanding that making change on deeply entrenched and challenging root cause issues will take time. With that, I'll hand it back to Jane.
All right, thank you so much, Justin. It's really great to see that the partnership has taken the findings from the CHNA and moved forward with your commitments to advancing health equity. So we'll start to transition into the Q&A portion of the webinar and go ahead and turn our cameras back on so you can finally see us. We're so glad to have assisted you with the CHNA process and that your CHNA continues to live on your HCI platform or Health Compass Milwaukee. That's absolutely the intent of the platform, is to be a hub for that community action for your CHNA. So as we're transitioning here into Q&A, please feel free to type your questions in chat and we'll try to get to them. I know we only have a few minutes, but as we're getting to those questions, maybe I can just go with each one of you as far as, what are your key takeaways from this process? And Justin, I'll start with you.
Yeah, I think I spoke to it just a bit in that we acknowledge that, the first step for us were to elevate the issue of equity across all of our institutions, and that in and of itself is a task, right? So we wanted to put that front and center in the CHNA, knowing that our community health and community benefit leaders in the healthcare systems in Milwaukee really are aligned and driven to make change in that issue area. And then I think we strive to have as much community input in the process as possible. Again, doing a community health survey is not the most enticing thing during a global pandemic for folks, but wanting to do our best to get engagement from the communities that are most impacted in this work through our process.
Yeah, that's perfect. Bridget, how about you? Some key
When I think
takeaways.
about it from a lens of a member of the partnership and the value that this shared process has for each individual institution that's engaged, I think about the purpose and the true purpose of the CHNA. And the purpose is really to understand deeply the needs of the community. The voice of the community needs to be centered and engaged actively. And we can't dismiss things that are really real conversations that need to be had, that identify and help us to better understand real barriers. Because if ultimately we are going to advance and improve the health outcomes of our community, which, by the way, is our responsibility through the health implementation strategy and plans, we can't do that meaningfully if we don't truly understand. And sometimes it takes wrangling with these really difficult conversations and understanding what the true experiences are of our community for us to create change. And so I think a key takeaway is the gratitude that I have for all the members of the partnership to be brave and to really advance and ask these questions so that we really can understand and come together both through the partnership and through other activities across our community.
Yeah, thank you so much. And we had a question come through in chat. I think we have maybe just time for one or two questions. Maybe Justin, you can answer this one. Is there a role, or maybe what is the role for in the triennial shared CHNA for the local health department, which I think you touched a little bit on it.
Yeah, so we are actually having conversations right now with the City of Milwaukee Health Department to have a even more coordinated partnership in our next cycle, really seeing that they're excellent in executing an on-the-ground community health survey and really touching the communities in Milwaukee, in the city of Milwaukee, that we struggled with an online survey. So integrating and sharing that, but also they collect a lot of great data locally, primary data that we could not only have as part of a CHNA, but incorporate on our Health Compass site. So we're seeing a lot of potential alignment opportunities with the city. Again, I explained that Milwaukee's a unique space in bringing along all public health department partners, and that we have a total of 11 and the county engaged as well. So a lot of convening and partnership conversations to come.
Thank you. And I apologize that you all can't see all the great comments coming in chat, but you're getting a lot of kudos for the work that you're doing. And I see that we're also just about out of time. So at this time, we just really like to thank Justin and Bridget and the Milwaukee Healthcare Partnership again for your time. And of course, thank those of you who are able to attend this webinar. We've put our main contact email on the slide here if you have any questions, and those who didn't get your answers to your questions, we'll try to follow up with you. If you're a current client of HCI, please feel free to reach out to your account manager or project manager if you have any questions. And thank you again, everyone, for joining us today. And that will conclude today's presentation. Have a great rest of your day.